Hey, what's up guys, and welcome back to the Sanctuary. I'm your host, Professor C, and today we're going to look more at A&P, specifically the integumentary system, and a rather unfortunate topic, we're going to look at the types of skin cancer. So, let's talk about it. Alright, not the most pleasant of topics to discuss here, but we have to start with, if we're going to talk about tumors and cancer of the skin, we need to talk about the cell cycle for a moment. So I'm just going to say, do you remember the cell cycle? If you don't, I have some talks on this back in the cell biology section if you want to go check that out. It says specifically, do you remember the Hayflick limit? This idea that approximately 50 times does a cell crank through this cell cycle. It goes through interphase and mitosis and interphase and mitosis and interphase and mitosis. Skin cells do this as well. So we say there's a Hayflick limit of mitosis of about 50. And after that, the cell has probably been used enough to where it needs to be thrown out and removed. So it gets a signal to destroy itself called autolysis. And we know this because of checkpoints, something I didn't get much into during the cell cycle. But think of it, before you go from, say, G1 into this S or R phase of DNA replication, there's probably a checkpoint here. And some system is looking to make sure that that cell is actually ready to move into the phase. When you go into the next phase, G2, you're probably going to have another checkpoint here to make sure everything's okay. And then one before you enter mitosis, one when you come out of mitosis. And you're going to find even more checkpoints in this cycle that are not shown here, which makes sense. You want to make sure that you're actually doing the phases in order: the growth phase, the replication phase, another growth phase, P, M, A, T. Everything's good, everything's working, and the cell is functioning. The question is, what happens if the checkpoints become non-functional? What if nobody's watching the cell? What if nobody's saying, hey, you've divided enough, it's time for you to get out of the pool, so to speak? What if the cell keeps dividing 50, 60, 70, 200, 300 times? Well, what you're going to get is a cell that keeps dividing and dividing and dividing and dividing and dividing and dividing and dividing until you get a ball of cells which isn't really doing what it's supposed to do anymore, and we call this a tumor. A ball of cells that's growing out of control. Now, does that tumor mean cancer? No, it does not. It's not the same term, but it could be a sign of something worse down the line, and you have to watch out for these things. So let's look at these in more detail. Okay, so again, cancer doesn't start immediately. This is a problem that takes many, many, many years usually to happen, sometimes not. Remember, tumors are just large groups of cells that are dividing out of control. Most of them, especially ones found in the skin, are benign. Benign means not harmful. Okay, it may cause some problems, but we say they're not harmful, like threatening to your life, meaning they don't spread. They don't metastasize. And spread sometimes is not a mean enough word for metastasize. I think of the word invade, like the tissue is not only spreading, but it's invading other tissue and taking it over. Risk factors to tumor formation. Of course, exposure to UV light would be the one you hear about the most, which is true, and frequent irritation of the skin. If you pick your skin a lot, if you're around chemicals like gasoline or other, like you work at a dry cleaner, you have chemicals in the air that are frequently irritating your skin, this could lead to tumors too. There's a lot of different things that could cause tumor formation. All right, we have to talk about the electromagnetic spectrum for a bit, but I don't want to do a physics class, so let's not do that. You can look at all of the energy that's spit out by sources in the universe, and we call these waves that move through space that are generated by the electromagnetic field. We call this electromagnetic radiation, and we can show this in a series of charts that you see out there called the electromagnetic spectrum, which shows you all the types of electromagnetic radiation that could be present. So the range here is what's important. Now, if you talk about which one is most important to you in your daily life, it would be this teeny tiny sliver right here in the EM spectrum. We call this visible light. And we call it visible light because we humans can see this light. And this is how we generate all the colors of the rainbow. To keep it simple, it goes from about 400 to 700. I know it's a little bit more picky if you want to do this for real, but 400 to 700 nanometers is the usual wavelengths we talk about for visible light, 400 to 700. If you go above 700, which is the red side of the spectrum, you get into infrared. And if you keep getting bigger and bigger, you go microwave, radio waves, and on and on and on. If you go the other way, if you go under 400, you get into ultraviolet. Notice we're getting more violet. We can't see it, but some animals can. So UV, we get further down, X-rays, and then these teeny tiny wavelengths known as gamma rays. So I've just listed these out, the different types of waves: radio, micro, infrared, ultraviolet, X-rays, and gamma rays. Now, for this talk, we really have to limit ourselves to ultraviolet. It's really the one that makes the most impact on skin tumor formation. Okay, so again, the source of radiation, of UV radiation especially, comes from our sun. So I said anything under 400, but here's a good range. Somewhere 10 to 400 would be a good range, 10 to 400 nanometers. Again, we're looking at the nastiest in our normal living would be about 260 would be the most dangerous. Notice there's different types: UVAs, UVBs, and UVCs that come from the sun. UVCs are blocked almost immediately by the ozone layer, and they don't usually impact us at all. UVBs are partially blocked by the ozone layer, but some UVB radiation still gets through. And UVA radiation gets all the way through. This does represent about 10%. The output of the sun, which is quite a lot, is UV radiation. Okay, another image showing this. C waves are blocked by the ozone, as I just said. B waves do penetrate some of the ozone, and they do damage the epidermis and some of the dermis, UVBs. Now, UVAs are the most dangerous here because they do penetrate the ozone layer, and they do penetrate the skin all the way down into the dermis. And so UVAs do actually damage collagen. They cause wrinkling and sagging. So if you're a person that wants to have healthy, young-looking skin, the first thing I would say is get out of the sun, because the sun is causing that damage. Or put on some UV blocker if you're going to be out in the sun to keep your skin looking young and healthy. 50% of all the cancers are skin cancers, and almost every one of those is preventable by wearing a hat or wearing sun blocker or sunglasses or something like that to block the UV. Tanning beds, which are basically just sources of UV radiation. Most people get in them without any type of blockage on whatsoever. They increase the risk of cancers by hundreds of percents. The most I've seen is 700%. So be careful when you get in those things. There's a reason why, even in California, you have to be a certain age, like 18, to get in a tanning bed, because they know that it causes damage, and sometimes cancerous damage. Again, it's not going to show up overnight. Here we have a classic picture of a two-faced trucker. And what's happening here is this guy drove his truck with the window down for many, many years. The side that still looks young is the side that was protected by his cab. It was in the shade all the time. The side over here was, as he drove with the window down, the sunlight pounded it constantly. It took a beating. And notice how he looks, 20, 30 years older on that left side of his face over here than he does on the right side of his face, which looks quite youthful, to tell you the truth. This is sun damage, and people don't believe it till they see a picture like this. The sun not only is deadly, but will cause you to look older faster. Skin cancer, of course, is from some sort of tumor. It starts off always as a tumor of uncontrolled cell growth that grows and grows and grows and eventually starts to invade neighboring tissue. And that's when we call it cancerous. It's when it starts to become a problem. So the most common is this basal cell carcinoma. It's the least malignant, means the least bad, but you still, it's still, you have to watch out for it. The second most common is the squamous cell carcinoma, and the most dangerous type is the one I'm sure everyone's heard about, called melanoma, and it does invade other tissue quite aggressively, and you have to treat it quickly or you could be in trouble fast. Let's look at these one by one real quick. All right, a basal cell carcinoma. Again, this is the most common one, and it has to do with cells of the stratum basale, or basal, that bottom layer of the epithelium where we have highly mitotic cells growing and growing and growing, except they tend to grow faster and faster than they normally should. So the cells grow rapidly, they push down into the dermis, they push down into the hypodermis, and they'll push up above the surface of the skin, and they'll look like usually round raised bumps, just like this. Now, it's usually not a problem except if you don't like the way that it looks. And you can have these removed, usually in some sort of day surgery, very easily. 99% of the time you can cut this out, throw it in the trash, freeze it, burn it. There's many ways to remove these things, and you don't ever have to worry about it again, usually. Now, a squamous cell carcinoma, same thing, you have a tumor that's growing, but this one just appears different. There's a lot of differences that it can look like. But this involves cells in the stratum spinosum, that spiny layer in between the base and the granulosum layer. These cells are dividing out of control, and they'll eventually raise up the surface of the skin and protrude through it. It kind of looks like a wound at this point. Instead of just a raised bump, there's something more going on here than just a raised bump. So you commonly find these on the head, on the scalp, on the ears, sometimes on the lip, sometimes on the hands. And again, this is something that you have a good prognosis, that is a good outcome, if you treat it in a reasonable amount of time. Sometimes you have to do radiation therapy to get rid of the stubborn cells, but oftentimes you can have this removed surgically and you have a pretty good outcome. It's when it spreads too much, too far, is when you get into the danger territory. And then the real danger comes with this purple-black tumor. This is a melanoma, and this, of course, is not good when you have this, and you need to take care of this immediately. It's not going to go away. If you see something like this on your body, you need to go see a professional and have it analyzed. This could cause some serious issues. So this involves the cells called melanocytes that produce the melanin. That's why they look so dark colored, dark purple, dark black. Highly metastatic, meaning they spread very quickly. Highly resistant to all kinds of treatments, including radiation. Usually, to get rid of this, you have to cut out not only the area of the tumor, but area around it. So wide surgical excision is required to get rid of this, and sometimes they miss a bit, and if they miss a bit, it can grow back aggressively in the exact same spot that you just removed it. To tell if someone has a melanoma, you need to satisfy the A, B, C, D, E rules. And let's just look what these stand for. A is for asymmetry. The growth should not be a symmetrical round button like we saw with some of the other carcinomas. The border is uneven. It's hard to draw a line around the border. It kind of looks like an island in the ocean. It's not a regular structure. The color is dark, black, purplish, brownish. The diameter, the size of it is larger than 6 millimeters. That's about the size of a pencil eraser, if you can picture a pencil eraser size. If it's larger than that, it's possible that it could be a melanoma. And then E, the size is changing, the shape is changing, the color may be changing, sometimes very rapidly. So if you say you have a growth that's asymmetrical, it's got an uneven border, a dark color, a large diameter, and it's changing in size and shape and color, these are warning signs that you need to have this checked out. All right, not a nice topic to talk about, but thanks for watching. And if you enjoyed it, check out some of the other videos in my series. See ya for the next one. Bye-bye.